Hi guys, I'm Dylan Nguyen, and let's talk about the reformation of the healthcare system. So to start out, what is healthcare? Healthcare can be described as ensuring that all people have access to needed health services, including prevention, promotion, treatment, and rehabilitation of sufficient quality to be effective. And it can also be described as the degree to which health services for individuals and populations increase the likelihood of a desired health outcome. With that comes many problems, though, with the healthcare system, which includes insurance coverage, the declining quality of the healthcare system, and the inflation rate. So, to go off of that, let's talk about how's coverage. In the US healthcare, there's two approaches to insurance coverage. It would be public and private. So, private would be when citizens or businesses are obtaining health insurance from like Cross, Blue Shield, or like Kaiser Permanente. Public qualifying for public would be Medicare, Medicaid, or Veterans Affairs. So this was when the Affordable Care Act was introduced, which sought to move the U.S. closer to universal health care by expanding health coverage for millions of Americans by Medicaid expansion or the launch of health insurance marketplaces for private coverage, which include citizens from across incomes, age, race, ethnicities, and there is an agreement that the realization of universal healthcare in the US would necessitate significant upfront costs. So these costs, what are they? They would be related to physical or technological infrastructures changes to the healthcare system, including those at a government level, being federal or state, or it could be from the provider, which is hospitals or out of patient clinics. It also deals with ensuring or treating a significant previously uninsured but largely unhealthy segment of the population, including the expansion of the range of services provided. So, the Affordable Care Act, again, its marketplaces and premium tax credits have played a critical role in providing people who don't get health insurance through a job. So, their major coverage expansions took effect, and with that, the share of Californians without health insurance fell about 58%. So, with that, small California business owners and self-employed people are are doing great with the ACA providing a critical role in providing affordable health coverage by about 407,000 small business owners and self-employed adults in California. Wait, what did I just say? So the ACA, its marketplaces and premium tax credits have played a critical role in providing affordable quality health insurance coverage for people who don't get health insurance through their jobs. Their major coverage expansions took effect, and with that, the share of Californians without health insurance fell about 58%. But because premium tax credits weren't adequate for people with lower incomes and weren't available to middle income people with high premium burdens, some people still couldn't afford health insurance coverage or paid for health insurance at the expense of their family's other taxes and other things they have to pay for. But the ACA does play a critical role in providing more affordable health coverage, which they did to about 407,000 small business owners and self employed adults in California. This population does make up about 25% of the ACA marketplace enrollment among working age Californians, which causes middle income older people who have retired or don't have health coverage throughout their jobs to get it now. So this an example of this would be a 60-year-old Californian with an income of about 60,000, and he would pay 18% of income for benchmark health coverage without extended premium tax credits, which capped at premiums at 8.5% of income. Health insurance reduces medical debt and improves credit scores and access to credit, making it possible for people to buy a home or take on an auto loan that, in fact, also reduces the frequency of bankruptcies and evictions, with one finding that access to premium tax credits significantly reduces the share of people delinquent on rent or mortgage payments. So, another problem would be quality and population. Improving the quality of healthcare across a nation is complex and hard. Countries do rely on multiple single national level programs to make progress, but the key is to use a framework to develop a balanced overall strategy and evaluate the main elements continuously and over time. Achieving that does require a great mass of leaders who collectively can see the bigger picture and envision a roadmap for the future to chart an intelligent course. So when we build on that, we need to provide the population with some form of universal coverage of comprehensive benefits. Investments allow a decent level of quality to be provided and regulating care providers, in particular the medical profession. It's a problem though, since some countries do lack the ability to make changes, as power over different levers is widely distributed across different parties or different levels of system. So let's talk about the steps to start improving on healthcare. So our first step would be clear, and we would have to use the Institute of Medicine's definition of the six domains. It would be safetyness, effectiveness, patient-centered, timelessness, efficiency, and equity. Then we got to consider the balance of the three core functions in achieving high quality uh, healthcare, which would be planning, improvement, and control. So for that, in context of that, that means effective strategic planning for quality at a national level, support for organizations and professions to improve care, and control mechanisms to ensure progress and mitigate risk. So our third one would use framework to spot weaknesses. To do that, it would be like weaknesses in a national strategy or spot potential gaps and organize quality related activity. Our fourth would to build capacity to improve quality at different levels in a country, such as different geopolitical or administrative tasks or institutions. So we could ensure the capability to improve quality and ownership develop at each level, and that the synergy of activities at each level is good. So our fifth concept would be to consider the initiatives according to who or what is their intended target, like people individually or people collectively in the healthcare system. Given that some only directly target quality, it is important for any strategy to define the scope of what might be included. Factors that might progress include charity and balance in elements of multi-level strategy, wise choice of doable initiatives, investments, competent and well-monitored implementations, solid evaluations, and patience in the pace of progress. So the aims of effectiveness and safety are targeted through process of care measures, assuming whether providers of healthcare perform processes that have been demonstrated to achieve the desired aims and provide these processes that are predisposed towards harm. So our last problem would be the inflation rate. So every American does deserve the peace of mind that quality, affordable health insurance brings, and they should not have to choose between buying the medications and providing food for their families and themselves. To combat this, we have the Inflation Reduction Act. With the Inflation Reduction Act, we plan on protecting millions of Californians from drug costs and capping Medicare patients' out of pocket costs in Part D at $2,000. Currently, Medicare patients with conditions such as cancer, sclerosis, and lung disease can face thousands of dollars in pocket prescription drug costs, and millions of people in Medicare continue to struggle to afford their medications. With this act, though, we will require Part D plans to offer improved financial protections, and each year it will benefit about, let's give it 114 California Medicare patients who would otherwise have out-of-pocket costs above the cap, and according to estimates from the Kaiser Family Foundation. By allowing Medicare to negotiate prices for high-cost drugs, it also provides seniors and people with disabilities who have Medicare coverage with new protections against unaffordable prescriptions for their bill. The legislation will save billions of dollars for both Medicaid beneficiaries who will see reduced out-of-pocket costs and the federal government following that. The act requires companies to pay Medicaid a rebate if they increase drug prices faster than inflation. That will achieve billions more in savings for the federal government and will further reduce out-of-pocket costs for Medicare beneficiaries. This will then tie to how drug manufacturers are raising insulin prices so rapidly. And this will have Medicare patients who struggle to afford this life-saving drug, which usually costs less than $10 to manufacture. The legislation will then cap this cost for the insulin and the patients will pay no more than $35 for a month's supply. The act also extends eligibility for full Part D low income subsidies, known as extra help, in 2024 to low income patients with incomes up to 150% of poverty and modest assets. Currently, individuals with income between 135% and 150% of poverty only receive partial help, meaning that they will still pay premiums and face more significant copays. About 24,000 California Medicare patients receive partial extra help in 2020 and could be helped by expansion of income eligibility for full extra help, while Medicare Part B covers vaccines such as the vaccine for shingles must pay for a portion of costs out of the pocket starting in 2023. The legislation will require zero cost sharing for vaccines for Medicaid Part B and D beneficiaries. And now some 462,000 California Medicaid patients received a Part D vaccine in 2020, and that number is likely to rise as those vaccines become more affordable. So that will be the end of my reformation of the healthcare system, where we plan to help with the insurance coverage, the quality, and the inflation rate. Thank you for listening.